Can I come in?
Yep.
Alright. Hi, I'm Kaylee.
Hi.
I'm going to be your nurse today. I'm just going to wash my hands real quick and shut the door for privacy and we'll get started.
Okay.
Alright. Can you say your name and birth date for me?
Olivia Stander, February 5th, 1991.
Okay. And how old, and do you have any known allergies?
Sulfa.
Sulfa. Okay. How old are you?
I'm 22.
Okay. Patient appears stated age. Do you know the year?
It is 2013.
And where you are right now?
I'm at the doctor's office.
And the situation?
Checkup.
Okay. Patient, and your name again?
Olivia Stander.
Patient appears alert and oriented ×4. No known signs of illness, good hygiene, no odors coming off her, appropriate dress. Patient's posture is very good. Are you experiencing any pain?
I'm not.
Okay, that's good. And how are you feeling today?
Good.
Patient's mood and affect are congruent. Patient's speech is normal and appropriate. Okay, we're gonna start the assessment and start with your head. Alright, I'm just gonna palpate your scalp and look for any lesions or masses. No signs of head lice or parasites. Your head feels right size and symmetrical. I'm gonna go on now to your face. Can you say yes when you feel my finger?
Yes. 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 Yes.
Alright, and can you puff your cheeks, smile, and frown, and blink your eyes? Alright, that was checking for cranial nerve 5 and 7, which everything looks symmetrical and normal. Now I'm going to check your eyes and your perla and accommodation. If you could just look straight and keep looking straight. Alright, reflex to the light was normal. And I'm going to check for accommodation real quick. Can you just keep your eye on the pen? Alright, good accommodation. Conjunctiva is pale pink, which is normal. Eyes are symmetrical. Pupils are appropriate size. Sclera is white. Alright, now I'm going to check your mouth. If you could open your mouth wide for me. Alright, tonsils are intact, grade 1. Uvula is midline. Mucosal membranes are moist and appropriate. Teeth are all intact. Do you have any dentures or fake teeth?
No.
Okay. No signs of bleeding in the gums, and tongue is appropriate color and looks good. Now I'm going to check your lymph nodes and make sure there is no swelling, which if there was swelling that would be abnormal. This is the pre-auricular, post-auricular, jugulo-digastric, occipital, posterior cervical, superficial cervical, deep cervical chain, and this is the supraclavicular, submandibular, and submantle. Alright, everything felt good. Was there any tenderness?
No.
No? Okay, now I'm going to look at your extremities, your upper extremities. Alright, have you noticed any lesions or abnormal coloration or
No.
anything like that? Okay. Temperature is normal. Capillary refill is with 1 to 2 seconds. Alright, now I'm going to check your pulses. This bilaterally, this is your radial pulse. And your ulnar pulse. And your brachial pulse. And I'm going to check your strength. Can you squeeze my fingers? Alright, strength was good and normal, symmetrical, no weaknesses or anything. Alright, now I'm going to check your carotid artery pulse. Palpate. Okay, and now I'm gonna check it with the bell. Alright, no signs of bruise. Patient's AP is normal 2-to-1 ratio, no signs of a barrel chest. Now I'm going to osculate your lungs, starting at the posterior side. If you could take a deep breath in and out with your mouth when you feel the diaphragm on your back. Alright, no signs of adventitious sounds. Now I'm going to do the front. If you could just take it. Alright, sounds normal, no adventitious sounds on the back either. Now I'm going to check your heart. This is the aortic, the pulmonic, Erb's point, tricuspid, and the mitral, which I'm going to listen for 60 seconds. And now I'm going to flip it over to the bell and listen for another 60 seconds on the mitral. And come back on the tricuspid, Erb's point, pulmonic, and aortic. And the S1 was more apparent at the apex, and the S2 was louder at the base. Alright, now I am going to ask you to lie down. Alright, this would be done on the bare skin of the abdomen. I'm going to osculate from the right lower quadrant to the right upper quadrant to the left upper quadrant to the left lower quadrant, which in the right lower quadrant there is the appendix, in the right upper quadrant there is the liver, in the left upper quadrant there's the spleen, and then there's the left lower quadrant. Alright, there are normal bowel sounds. Okay, now I'm going to percuss the right lower quadrant. Alright, there was predominantly tympanic, and where the liver is in the upper right quadrant, I heard dullness. Now I'm going to palpate. Just let me know if you feel any tenderness. Everything feel good?
Yes.
Alright. Everything felt good. Now I'm going to do your extremities. Okay. This is also done on the bare leg. Temperature feels good. There is 0 pitting, so no signs of edema. Can you push your feet down? And can you resist? All right, that was testing strength for the lower extremities, and it was symmetrical, no weaknesses. I'm going to listen to the pulses now. This is the dorsalis pedis. And the posterior tibial. Alright, and now I'm going to check the capillary reflex. It's normal 1 to 2 seconds. And I'm going to do the Babinski test. I'm going to do it once on each foot. Okay. There was no reflex, so that is normal. Alright, if you could stand up for me, please. Alright, I'm going to check your CVA for the kidney tenderness. Any tenderness?
Nope.
No? Okay, can you walk there and back for me, please? Alright, gait was appropriate, no shuffling or stumbling. Now I'm going to do the Romberg test. Can you close your eyes for me? Just going to do this for 20 seconds. Make sure she doesn't sway or fall. Alright, can you bend over for me? I'm just checking for scoliosis, no signs of curvature of the spine. Do you have any questions for me?
Nope.
Alright.